Hello, everyone, and welcome back to our Mental Health Monday series. Today, we are going to be talking about vagal nerve exercises. So the exercises that I'm going to demonstrate today are really beneficial for people who severely feel their emotions. So the people who really struggle with severe anxiety, who kind of feel the stomach aches and the knot in the throat and the tenseness, these exercises are going to be really beneficial for you guys. Anybody who really struggles with trauma responses, so the fight, flight, freeze, fawn, these are really beneficial. Any type of symptoms where your emotions are making you tense up or feel anything in the body that just feels uncomfortable or not right. So the book that I'm actually going to be using today is Accessing the Healing Power of the Vagus Nerve. You can buy this on Amazon or you can go to Barnes & Noble and they will order it for you. It is by Stanley Rosenberg, PhD. So wonderful, wonderful book. The first half of it does a really good job explaining the value of these types of exercises and explaining the different things that they can help with. So the first exercise we're going to go over today is the basic exercise. So this is something that's really good for people to use to kind of increase blood flow to the brain stem, relax kind of that inner core when you're feeling that tight tenseness. So what we do with this is we are going to interlock our hands starting. So just simply interlocking. They don't have to be super tight, just kind of a comfortable position. And then you can do this sitting or standing. It's however you feel most comfortable. So the next part that we're going to do is we're going to put the hands behind the back of the head, and you're just going to kind of make sure that you move your head back to kind of gently rest within your hands. Okay? Keeping your head in place, you look to the right, moving only your eyes as far as you comfortably can. Do not turn your head, just move your eyes and keep looking to the right. So again, fingers interlocked behind the head, kind of resting it back, and then looking to the right. So you'll notice that my head has not moved at all. It's just my eyes looking to the right. So that's the second part of this exercise. Next, it says after a short period of time, up to 30 or even 60 seconds, you will swallow, yawn, or sigh. One of those three responses will happen. This is a sign of relaxation within your autonomic nervous system. A normal in-breath is followed by out-breath once you kind of feel that. So as soon as you have one of those three responses, the swallow, the yawn, or the sigh, you just kind of want to take a minute to breathe, okay? So again, fingers are interlocked comfortably behind the head. We're looking to the right. Again, my head is not moving, my neck is not moved. It helps if you do this part in silence or with some kind of calm meditation sounds in the background. There it is, the yawn. So then I want to re-look in the center and just take a moment to breathe, and then we can bring the hands down, okay? So after you're done with that, you can go ahead and move your eyes to the left. So you don't have to bring the hands down. You just want to look to the right long enough to have one of those three bodily responses. Recenter, take a breath, and then you're going to do the same thing, looking to the left without moving your head. Again, you're going to notice the sigh, the yawn, or the swallow will come after about 30 to 60 seconds. Then again, you want to recenter, take a deep breath in and out, and then you can go ahead and bring your arms down. So again, the basic exercise is all about interlocking the fingers, finding a comfortable position, and just looking to the right until you have that response, recentering, breathing in and out, looking the other direction, waiting for that response, recentering, breathe in and out, and go ahead and lower your arms. So this is called the basic exercise. And again, it really works to kind of address your nervous system. So another exercise that is really, really good is the neural facial release technique. So this one is really good for people who deal with headaches and things of that nature as part of their symptoms. So anything that deals with like tightness in the jaw, anything that deals with like pain around the front part of the face, I highly recommend the neural facial release technique. So what we do with this is you're simply going to take your thumb and you're going to push gently at the base of your skull on one side and feel kind of the hardness of the occipital bone. You're going to test the slidability of the skin on one side of that bone. Gently slide the skin over the bone to the right and then let it come back to neutral. So you're not forcing anything. You're really just kind of placing the thumb right there on that bone and just kind of moving the skin around. Then you slide the skin to the left and let it come back to neutral. At this point, you want to notice which direction you felt the most resistance. Once you point that out, slide the skin in the direction of the greater resistance, moving very slowly. And be ready to stop at the very first sign of any resistance. It may only have moved 1/8 of an inch or less, and that's completely fine. Stop there and hold that position with your thumb. Continue to feel the resistance. Go ahead and pause, wait, and you will likely sigh, swallow, or yawn. Once you do that, you can go ahead and release. Take a breath, go back, and then if you try and push the skin back in that resistant direction, you should notice more flexibility. Again, this is something you can do on both sides with both thumbs. You can do one side at a time. Whatever it is that you're most comfortable with, this is a really, really good exercise to help with those headaches and things that we really tend to feel above the shoulders. Okay, this is another exercise that is really good for the whole central nervous system. This one's also really beneficial for people who deal with things like depression, low motivation. This is something that you can do kind of at the beginning of your day whenever it starts to kind of loosen yourself up and start to get certain body parts activated that are going to help you start to release some of that confused tension that may be inside. So this is called the half salamander. Funny name, I know, but it's really, really beneficial. So what you're going to do is you're going to sit, or you can stand in a really comfortable position. Just kind of relax your body as much as you can. And then without turning your head, much like the earlier exercise, you're going to let your eyes look to the right. So completely looking to the right, not turning your head. Again, it's just eyes. You're going to continue to face straight forward, and then you're going to tilt your head to the right so that your right ear moves closer to your right shoulder without lifting the shoulder to meet it, okay? So again, forward, just looking with the eyes, and then we're going to start to go down and notice that I'm not lifting my shoulder to meet my ear. I'm not moving my shoulder. It's staying completely relaxed. You're going to go ahead and hold your head in that position for 30 to 60 seconds. Then you're going to let your head come back up to neutral and shift your eyes back to the front. Now you're going to do the same thing on the other side. Let your eyes look to the left, slightly bend your head and your ear towards your shoulder without lifting it. Wait another 30 seconds. Come back up. And you should start to feel, again, that kind of looseness, but also kind of that start of the activation of the vagal nerve. This is a really beneficial exercise for you to use. And again, I highly recommend using a variation of all of these. The final one that we're going to do is the twist and turn. So this is a really good part of the book that I really enjoy because it really aims to look at exercises that work towards strengthening the vagal nerve. And that's what we want. The stronger your vagal nerve, the stronger your resilience is going to be when it comes to those bodily responses to certain things. So with the twist and turn, there are 3 different parts to the exercise, but overall it is very simple. All you're going to do is sit comfortably, feet flat on the floor, and fold your arms across your body, and you're just going to let the hands rest. So you don't have to grip tightly on your elbow or your arm. They're just kind of resting. As you do that, you're going to just kind of start swaying side to side. So again, very, very gentle, and you're just kind of moving your body. Again, you don't want to push past any resistance. If you feel pain or tension, go ahead and stop and then start to move back the other way. You don't have to force your body further than it can go. Once you're done with that, you're going to go ahead and you're going to slightly let your arms glide lightly over your stomach. This activates the fibers of your upper trapezius, and this is part of your vagal nerve system. So again, just kind of loosely have your shoulders. You're moving back and forth. Don't push beyond resistance. And then at the end, you're going to take those hands and you're just going to lightly brush against your stomach about 3 times. Okay. Once you are done with that, you are going to go ahead and lift your elbows and hold them in front of your chest at the level of your heart. And you're going to do the same thing. This activates the muscle fibers in your middle trapezius. So this time, kind of up, level with your heart. Again, we're not gripping tight. It's just kind of a loose hold, moving back and forth. Not going beyond how far we can move. Stop if we feel pain or resistance. And then you're going to come back. Again, you're going to drop your arms and kind of brush up and down the 3 times on your stomach. Once you're done with that, you're going to raise your elbows as high as you comfortably can. Again, don't push yourself to any point of pain or discomfort. You're going to repeat the exercise 1 more time, and this will activate the muscle fibers of your lower trapeze. So the final part of this exercise is, again, same thing, arms up. We're not grabbing tight, it's just kind of gently resting. We're moving back and forth. And then we recenter. And this time you just want to take a deep breath. And then you can go ahead and lower your arms. So again, that exercise is called the twist and turn. And this is a really good one just to kind of incorporate into your daily movement and mindfulness time. So I highly suggest doing these things either in the morning, start of your day, late in the evening, whenever you feel like you can kind of spend the most time really focused on this. It doesn't take long. These exercises can take about 10 to 15 minutes, used 2 to 3 times a day, or when we start to feel some of the symptoms strengthening. So again, the book is called Accessing the Healing Power of the Vagus Nerve. Highly recommend this book. Hope everybody has a great rest of your day, and I will see you all next week. And don't forget that mental health matters.